And our next speaker is Dr. Joseph Calabrese. Dr. Calabrese is the director of the Mood Disorder Program at University Hospital's Psychiatry Department, and he is also a professor of psychiatry at Case Western Reserve University. He has provided enormous, wonderful counsel to many, including myself, and I am so thankful for him for that. And we are lucky to have him here tonight because he recently has been in Japan and really all places in the world. He's an internationally renowned expert on the topic of suicide, and it's our privilege to have him share some of his wisdom with us here tonight. So please join me in welcoming Dr. Joseph Calabrese.
Thank you, Lori, and thank you all for coming tonight. Tonight's going to be a good night to celebrate and a good night to remember. But before doing so, I wanted to share with you a little bit about suicide and a little bit about depression. And what I will be reviewing is available for you on your picnic tables there. And I put this in writing because of you guys. I would suggest that you get an electronic copy of that and put it up on your bulletin boards at school and help other people learn what you're learning tonight. And if you would like an electronic copy, just call me or maybe call or email Pat and she'll get that for you. So what this contains is what I thought was the 7 most important things to remember about suicide. So the first thing is, how common is suicide? Does anybody know? Well, last year, the number of suicides was 35,000. Now, the number of homicides last year was only 15,000. So that's a remarkable figure. Now, the next thing to keep in mind is why people suicide. Thoughts about suicide and attempting suicide is not a weakness. It's not a personality flaw. Suicides occur because people have an illness. And in 90% of instances of completed suicides, there is a pre-existing psychiatric illness. And it's normally a mood disorder. There are 2 mood disorders. One is depression and the other is bipolar disorder, which used to be called manic depression. Now, when people think about suicide, if you want to know why, it's because thoughts about hopelessness is a very important symptom of depression. And when people feel hopeless, they think about suicide. And there are actually things going on in the brain, chemical changes, in the prefrontal cortex and the limbic system that reveal a biological basis to hopeless thoughts that lead to suicidal thoughts. Now, when people begin to have thoughts about suicide, it's usually because of a depression. Now, you might say, when does that occur? Well, of those who do have a mental illness, 50% will have the onset of symptoms by the age of 14, 75% by the age of 25. So these are the most common chronic illnesses of young adulthood, the most common chronic illnesses of young adulthood. About 5% of the suicides in 2011 were children and adolescents. About 1/3 were young adults. And just a little under 50% were folks in midlife. Now, one other thing to keep in mind about suicide is, although it's the thoughts about depression that lead to thoughts of suicide, it's usually another illness that prompts somebody to attempt suicide. So it's the symptoms of depression that make you think about suicide, but it's other things like alcohol, or co-occurring anxiety, or PTSD, other illnesses that change somebody from thinking to planning, and from planning to attempting. So it's not just about depression. We have to look out for other things. And alcohol use is right at the top of the list. Now, the last thing I want to end with is a very positive note. There is excellent treatment for mood disorders. And mood disorders are some of the most successfully treated illnesses in all of modern medicine. So with that note of optimism, have a good night and a good walk, and I'll be right behind you.